if you were starting to notice that you can't walk as long as you used to be able to without feeling a deep achy feeling in your legs or some low back pain or some numbness and tingling, you might be suffering from lumbar spinal stenosis. My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley. And today I'm going to talk all about lumbar or low back spinal stenosis, what it is, what it might look or feel like, and what you can do about it. Now, first of all, what is spinal stenosis? So it can happen in any part of your spine. It's most commonly in the neck or the low back. And stenosis just means a narrowing. So it's either a narrowing of the intervertebral foramen, where the nerves exit from the spinal cord and go out to the muscles and organs of the body, or of the spinal canal itself, where the spinal cord is. Now, usually this is related to aging, normal degenerative changes, wear and tear that might happen, either causing a bony buildup around where the nerve exits or on the vertebrae itself, causing the joint to get rough. And this creates less space for the nerve. There might be some thickening of the ligaments. And what that happens is that the nerve has decreased flow, essentially, to the muscles and can also increase pain. You might have sensations of weakness or sort of like a fatigue, deep ache in the legs. It might be one leg or both legs. You might have increased low back pain or leg pain or a numbness and tingling into the leg or foot. You might find that it actually feels better if you're walking uphill or if you're sitting. Now, what can you do about it? So I did a whole video about exercises for lumbar spinal stenosis that I encourage you to watch. But generally, we want to think about less back bending or arching and more tucking the tailbone under or bending forward. So you can think about that when you're walking. You can do more of a tailbone tuck, and that opens up the space for the nerves. You can look for a bench when you're out for a walk, and you might find that just a few minutes of sitting is a reset. It creates space, takes the pressure off the nerve, and you can keep going. If there's no bench, you can simply lean forward onto your knees for a few moments just to open up that space. If you're grocery shopping, take a shopping cart. That little bit of a lean on the cart will prolong your ability to walk and continue shopping. If you have to stand for an extended period of time, a low stool or a pile of books, just so you can place one foot up on that creates a bit of a pelvic tuck. And then again, we're not pinching the nerves in the low back. We can also think about the posture of the upper back, because if we are rounded through the upper back, then we start to compensate to get more upright by arching through the low back. So when you're walking, think about open shoulders, chest open, squeezing the shoulder blades together a little bit, and that's going to help you stand more upright without arching through the low back. From a chiropractic perspective, we're going to try and optimize all the joints of your spine. So we're going to work on that upper back posture. We're also going to work on the movements of the joints in the low back so that nothing there is contributing to that pinching of the nerve and improving that ability for the nerves to flow to the legs. So we might also be working on some of the muscles that might be contributing to that poor posture and creating more of an arched spine position. You do not have to live with the discomfort of lumbar spinal stenosis. There are things that you can do. If you'd like to book online with us, you can book at willowbrookchiropractic.com. We post regular content under Willowbrook Chiropractic on YouTube, Facebook, and Instagram. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.